Are your dogs, your cats getting too many diagnostic tests? Here's what you need to know on how to best help your dog or cat. Hello, welcome back to my channel. If you're new, welcome. Click there to subscribe, hit the bell to sign up for notifications. Then when you click that link directly in the box below, I can send you a copy of my free book. A bunch of recent studies in human medicine have come to this conclusion that there is an overuse of diagnostic testing that is substantially contributing to healthcare expenses, and it's potentially exposing patients to undue, unnecessary harm. In other words, there's just way too many diagnostic tests happening in human medicine. The very same thing, in my opinion, is happening in veterinary medicine. There's a huge number of examples and stats in human medicine. You know, one big example, people that have had hysterectomies. That's where your entire uterus, your cervix is removed. They're saying in women over the age of 30 who have had a hysterectomy, they don't have a cervix, 2/3 of them reported to being screened for cervical cancer. Yeah, how can that be? How can someone who doesn't have a cervix get screened for cervical cancer? There's umpteen examples of people that have been diagnosed or being treated for a terminal type of cancer, i.e. colon cancer, then they're also getting a mammogram. To put numbers to this, it's estimated in the US, $75 to $100 billion a year is being spent on potentially unnecessary diagnostic tests. But do you really think this could be happening to your dog? Like, is this something you need to be concerned about? Do you think your veterinarian is doing unnecessary tests? There are multiple examples where you start out with one diagnostic test, i.e. say this chest x-ray, you see potentially a mass on the x-ray. Okay, we've got to investigate that. We've got to further image that. Maybe we've got to biopsy it. Or it turns out that's not even a finding. Doctors actually now label this incidentalomas, meaning it's something that's just there. Maybe it's a shadow, a collection of blood vessels, but someone interprets it as a mass or a cancerous mass, and it leads to what's called this cascade event. It's more tests, more diagnostics tests. I mean, many of you probably experienced that personally. The very same thing can happen with our animals. More tests, potentially leading to more tests. Part of this comes from a video I did about things I wouldn't do since being retired veterinarian. One of them was fecal flotations versus routine deworming. Honestly, I mean, there's lots of times in a fecal flotation you don't see eggs or not. Still possible your dog, your cat may have intestinal parasites. You look at the risk of these very safe dewormers. The example I gave was Panicure. In that case, I'd be comfortable just routinely deworming my dog, my cat yearly without doing the fecal flotation test. An example, I recall years ago in veterinary practice, seeing a second opinion. A client's dog had gone into another clinic, had been worked up. The dog was lame on one leg, limping on one side. His left knee was swollen, rear swollen lymph node. The concern was like, is there some sort of joint disease going on? Maybe we need to be doing blood work. Maybe we need to be doing actually joint taps, like additional diagnostics on this dog to try to figure out, has he got some serious disease like autoimmune polyarthritis? Yes, that's all possible. I mean, you can have some of these really unusual diseases, but as we learned in veterinary school, common things occur commonly. If you got this sort of middle-aged, pretty active dog who's running after a ball, acutely lame, much more likely to have injured his ACL. That's what he'd done. The lymph node is swollen because of the skin infection. But on palpation, you can actually get a thing called a drawer sign, confirming that he'd torn his ACL, and that's why he was acutely lame. So no, he didn't necessarily need to do all these extensive blood tests. He didn't need to have joint taps. He didn't need to have tests for immune-mediated polyarthritis. Why are there so many tests done in human medicine? Why does it seem to be like there's so many tests done in veterinary medicine? I mean, these researchers, they're pointing to 3 key points. Number one, you know, just dollars, right? The more tests, there's more dollars received. You're working as a physician, you get paid based on what you're doing. You do more tests, you make more money. Okay, fair enough. Secondarily, there's the concern by the doctor, there's the concern by the veterinarian that they're gonna miss something. And it's really been drilled in, like, don't miss this zebra, this really unusual disease, or don't miss this mass. Where in reality, uncommon things, they don't happen very often. And it's really important to go back to clinical signs. You know, what did the patient present with? What is the most likely diagnosis based on all those clinical signs? And then you're having the diagnostic tests, the ones that need to be run to support that diagnosis. Third big pressure, that's coming from patients themselves. So it can be from you as the client, you're seeing your veterinarian, like, are you sure he doesn't have this? Like, maybe we should just order an MRI. Let's just make sure that, I know he's sore in his back, let's just make sure he doesn't have some type of like spinal tumor. What do? Well, you start by asking questions. Man, do we need to do that diagnostic test? And if we don't do that test, is it going to change your current course of treatment? So do you do the blood test? Do you do an x-ray? Do you do a CBC, see if the white cell count is up? Or do you just go ahead and symptomatically treat your dog? You also have to be really aware of this cascade event. You know, or you initially do one sort of diagnostic test, you know, i.e. again, that x-ray. Maybe someone suspects, oh, there's a mass here in the abdomen. Maybe there's a liver tumor there. Then we've got to do blood work. Then we need to do an ultrasound, maybe an ultrasound guided biopsy. Don't get me wrong, I did lots of diagnostic tests in veterinary practice. And some are hugely beneficial, like to actually figure out what's going on with the dog as opposed to sort of taking your best guess. But you need to start out with the basis. I always go back to some of these old professors in vet school who are just so keen on the importance of a very thorough physical exam as well as history. Like, you know, really narrow it down. What do you think is most likely going on? Being aware of all those clinical signs, being especially thorough. So are there too many diagnostic tests being run in veterinary medicine? In all likelihood, yes. You know, but what's the best thing that you can do for your own dog, for your own cat? So you need to be an engaged and involved pet parent asking a bunch of questions, right? If we do this test, what are we going to learn from it or not, right? You know, spend some time doing some reading, you know, getting an idea of, you know, some of the more common dog and cat diseases. Your dog or cat has certain clinical signs. Read about them, get an idea of what they could or couldn't have, and then, you know, discuss those with your veterinarian. Be aware of some of the things that are driving this. You know, it's not just financial. It's also like the worry to miss something unusual. Well, like, just be aware of that. Like, doc, do you really think he's gonna have this? Probably not. And then be aware of yourself. I mean, you're worried about your dog or cat, and it's probably easy for you to say, like, let's just do one more test. So just check in. Like, what is most likely going on with your dog or cat? Can we start with some simple test first? Most likely yes. Start with some form of treatment first? Most likely yes. If our dog or cat doesn't respond, then let's do the next test. Consider the next form of treatment. Start doing it sequentially as opposed to, you know, doing a whole bunch of tests at once, finding some incidentaloma, then doing more and more diagnostic tests. Thanks again for watching this video on diagnostic tests. Click up there to subscribe, hit the bell to sign up for notifications. Then when you click that link directly in the box below, I can send you a copy of my free book.